We're at a point now where the pain and suffering of prolonging our lives not only inflicts that pain and suffering on us, but it also inflicts it on our families. And we have a whole generation of baby boomers who are now entering that period that I'm 5 years into. Those folks born 1940, 46 and beyond are getting into the old age, the final stage of life. And we're going to have 60 million Americans facing the following question: how do I live the remaining years of my life in a productive manner without burdening my family and my society? And I'm struggling with that question as well. So what we have to begin looking at is the cost versus the benefits of prolonging life beyond the stages where the body can support what we have. And what I'm talking about is rationing. And I believe we have to begin saying no. And I think we have to start doing that by linking prevention and patient compliance with proper lifestyle choices. A prominent example follows, showing how this type of work could be viewed as acceptable. Let's take hypertension. What's required for hypertension? Proper diet, appropriate medication, regular and structured exercise, no smoking, not reduced smoking, not controlled smoking, none. Not the patch, none. No drinking, even during those wonderful NFL weekends.
Whoa, 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 whoa. Bud Light? It's light. It's only 100 calories, you know?
Non-compliance, if you have hypertension, leads vertically to one or more of the following: coronary artery disease, heart disease, diabetes, end-stage renal disease, which is a death sentence, dialysis, either renal dialysis or peritoneal dialysis, and ultimately an acute need for a kidney transplant. That's hypertension. We have other diseases we could vertically describe in a similar manner. Continued non-compliance and a refusal to change ultimately, I believe, will result in removing technology as an option for treatment. In other words, no transplant. Let's consider what happens with a person who has end-stage renal disease, kidney failure. Current cost of treating ESRD annually per patient is $80,000. That involves dialysis, medication, medical and surgical expenses. And in many instances, it's even more.